The infraorbital nerve block anesthetizes the pulpal tissue and overlying buccal periodontium extending from the second premolar to the central incisor. The infraorbital nerve is another branch of the maxillary division of the trigeminal nerve. It courses anteriorly through the infraorbital groove and along the infraorbital canal on the floor of the orbit. While inside the canal, it gives off the middle superior alveolar nerve, which provides branches to each of the premolars. In some cases, it also provides sensation to the mesiobuccal root of the first maxillary molar. Further anteriorly, it gives off the anterior superior alveolar nerve, which innervates the canine and the incisors. The infraorbital nerve exits through the infraorbital foramen, and its terminal branches provide sensation to the upper lip, side of the nose, and lower eyelid. The bony landmarks for this injection are the infraorbital notch and foramen. The client is fully supine. It may be helpful to have the client extend their neck and lift their chin. The operator sits at a 9 o'clock position for both right and left infraorbital injections. Palpate the notch on the inferior rim of the orbit. The foramen is directly inferior to the notch. Alternatively, line up the pupil of the eye with the labial commissure. The foramen lies on this line just below the orbital rim. Once the infraorbital foramen is located, place a finger over the foramen and retract the buccal mucosa in preparation for injection. Secure lip retraction is critical for this injection. Intraorally, the landmark is the height of the vestibule adjacent to the first premolar. Prepare the syringe with a 25 gauge long needle, bevel oriented towards the bone. Apply topical anesthetic to the injection site for 1 minute. Insert the needle until bony contact is achieved. Needle depth depends on individual anatomy, but will be approximately 16 to 25 millimeters. Once the bone at the roof of the infraorbital foramen is contacted, withdraw the needle 1 millimeter. Perform aspiration, and if negative, proceed to deposit 0.9 to 1.2 milliliters of solution. Notice that the syringe angle is not towards the apex of the teeth, as it would be with a supraperiosteal infiltration. Rather, the syringe is directed towards the foramen that was previously identified by extraoral palpation. This is necessary to avoid premature bony contact and depositing the anesthetic solution below the foramen. Following deposition, slowly withdraw the needle and safely recap. Apply firm extraoral pressure over the foramen for 1 minute. This directs the anesthetic solution into the infraorbital canal to surround the MSA and ASA nerves that innervate the anterior and premolar teeth.